Hello everyone, welcome to Infocular. Daily Dose 7 में आपका स्वागत है. Hope you've all been working hard. Hope you've all been working on your strategy and you're studying smart. Let's get started with the MCQs today. Which of the following is not the correctly matched selective media? A. McConkey agar enterobacteria. B. Selenite F broth for Salmonella and Shigella. C. Deoxycholate citrate agar for Salmonella and Shigella. And D. Lowenstone-Jensen culture for Mycobacterium tuberculosis. The question asks selective media. McConkey agar is the selective media for Enterobacteria. Selenite F broth is an enrichment media. Even though it is specific for Salmonella and Shigella, this is the answer which is not correctly matched because it is an enrichment media, and the difference between a selective and enrichment media is enrichment media liquid form में होती है, even though both of them inhibit the growth of unwanted bacteria, but enrichment media is liquid, whereas selective media is solid. DCA again is true for Salmonella and Shigella, and LJ is correctly matched with Mycobacterium tuberculosis. Next question is, relief of classical angina pectoris by nitroglycerine is seen by A. Coronary vasodilatation, B. Increase in total coronary blood flow, C. is reduction in coronary preload, and D. is redistribution of coronary blood flow. The question is asking classical angina pectoris. Classical angina क्या होती है? Stable angina, which is precipitated by some activity. This is ordinarily relieved by reduction in preload due to vasodilatation. So the answer is reduction in coronary preload. Variant angina जो vasospasm से होती है, वो coronary vasodilatation से relieve होती है. Variant angina. Moving on to the next question. P wave is inverted in A. lead 1, B. lead 2, C. AVF, and D. AVR. Questions 3 to 5 questions ECG के आते ही हैं एग्जाम में. Usually 1 or 2 are slightly difficult, whereas 2 to 3 is very direct, and if you know the basics you can answer it. जैसे normal P wave is inverted in. तो P wave की basic introduction जाननी जरूरी है कि polarity is positive in lead 1, 2 and AVF. AVR usually negative होती है. So this is the exception. And shape जो है P wave की वो generally well rounded होती है. It is not notched or peaked. इसके अलावा height कितनी होती है? 2.5 small squares की, that is 2.5 millimeter, and width is 0.1 seconds. और इसका main चीज क्या है कि P wave is due to atrial depolarization, okay, and it is seen negatively in AVR. So the answer is D, AVR. Normal P wave is inverted in AVR. Moving on to next question. Most common cause of ocular morbidity in India is A. Refraction error, B. Cataract, C. Trachoma, and D. Conjunctivitis. If you go with the flow, you will end up marking cataract. Maybe because you've not paid attention to the word morbidity. Mortality नहीं पूछा है या blindness नहीं पूछा है. Morbidity है, मतलब सबसे ज़्यादा basic problem in India due to ocular reasons is, and the answer is refraction error. Children में approximately 54% is due to refraction error. Cataract is the most common cause of blindness in India, and trachoma preventable blindness में आती है. Conjunctivitis is just another option to trick you. So the answer is refraction error. Indicator for Herox apparatus is A. Orthotolidine, B. Bromocresol purple, C. Starch iodide, and D. Orthotolidine arsenide. आप सोच रहे होंगे कि क्वेश्चन सारे इतने ऑब्जेक्टिव क्यों हैं जिसमें कॉन्सेप्ट्स कम लग रहे हैं? बिकॉज एग्जाम पैटर्न इज सच दैट देयर आर फ्यू क्वेश्चंस व्हिच आर वेरी माइंड प्रोवोकिंग, वेयरएज फ्यू क्वेश्चंस आर वेरी डायरेक्ट, एंड इफ यू नो द फैक्ट्स राइट, आपके डायरेक्ट क्वेश्चंस सेव यू टाइम, सो यू नीड टू नो सच क्वेश्चंस. हेरॉक्स apparatus. What is the requirement of Herox apparatus? It is required to measure the amount of bleaching powder required for disinfection of water. ये PSM के practicals में पढ़ा होगा. And the indicator for that is starch iodide. Bromocresol purple जो है, this is actually an indicator for कोलिफॉर्म टेस्ट इन केस की वाटर की बैक्टीरियल कंटामिनेशन टेस्ट करते हैं जब हम फॉर ई कोलाई, उसके लिए ब्रोमोक्रोसॉल पर्पल यूज होती है. That's about it for today. Hope you've been reading well. Please go on. Please be motivated and आप continue रखें अपने efforts. Happy reading.